Good evening, everyone, and welcome to the Deaf and Hearing Impaired virtual panel discussion, A Life in a Quiet World. I'm the facilitator this evening, Mary Hamilton, a member of the Concord Alumni Chapter of Delta Sigma Theta Sorority Incorporated. I have the pleasure of introducing our chapter president, Sora Bridget Herring-Williams, who will bring the welcome this evening.
Good evening, everyone, and welcome to the Concord Alumni's Deaf and Hearing Impaired Life in a Quiet World. We are just happy that you are with us this evening. During COVID, we just realized some things that we had not ever considered or thought about when everyone had to go virtual, and using Zoom and other methods of other virtual software in order to be able to communicate with each other. And so we ended up learning a lot about some of our sorors in our chapter. As a result, it caused us to begin to think about many of our family members. And a lot of us can actually relate and know that we have family members that have a hearing impairment, or they may be experiencing being deaf. And it's just something that being audible is something that we've just never really considered. And so tonight we invite you to be here so that we can learn more and learn how we can be supportive to those that we love and care about and be more sensitive to those around us. So again, thank you so much for being here and enjoy your evening.
Thank you. So now we're going to go ahead and watch a short video so that everyone here can get a clear understanding of what it is like to face hearing loss in today's world.
And we'd go out to recess, and there was this older guy. He might have been in like 5th or 6th grade, and always used to pick on us. And I didn't really know what to do about it.
Today we went to a high school, and
I was posing for a picture with all of my girlfriends, when all of a sudden one of them reached over.
You read my notes.
Can you read?
Can you read my lips? Can you read her lips?
My God, Clementine loves bread. She's still a little fucking.
Can you read his lips?
I have 2 dogs, one boxer. She's 7 months.
I am deaf. That's my word. It's a hearing one. I rely on the visual, not the auditory. The verb lip reading implies reading, like reading a book
whose text is legible and clear.
But the human face isn't a book, and lip reading isn't reading. People mumble, people talk fast enough loudly, people have facial hair like arms, lips like sphincters, people cover their mouths, people have accents. But real conversations don't take place in a studio.
No, not right.
We need to gather a vessel without all the pieces. I look in on your mouth and try to grasp with one sense information intended to another. There have been times when I've questioned why I even tried to read the way through this song. but I could just use sign language. Some deaf people choose to do just that. It's like a different word, a word that with rich expression and culture. When people sound, they come alive. But I know I want both words. Communication is never a given.
Tuesday, I woke up, had a
And
rash.
she just pulled my dress down.
When I was little, my family got a cat.
Like Wednesday, hit him in the face. That was like the last thing.
When did I learn? I only cried twice.
But when the reading books, when I focus on one natural things and launch into a conversation, something clicks. Like then I feel something extraordinary. Human connection.
Thank you. So as we can see by watching that video, this can be very challenging for a lot of people in today's world. Does anybody have any questions based on just the video alone before we get into the panel discussion? You can come off mute if you do. I see powerful representation. Yes, definitely. All right, so let me go ahead and get into introducing the panelists today. I have the pleasure of introducing you guys to Dr. Heggs. She is a clinical assistant professor in the Department of Communication Sciences and Disorders at Georgia State University. She holds a Bachelor of Science in Education and Communication Sciences and Disorders, a Master's in Audiology, and a PhD in Public Health. Her main research interests integrate her clinical background and public health training to explore the disparities in health outcomes that exist within maternal and child health populations, especially as it relates to individuals with culturally and linguistically diverse backgrounds. Specifically related to communication sciences and disorders, she is interested in studying oral rehabilitation, interventions for adults with hearing loss, and their effect on improving hearing-related quality of life. Next, I have Dr. D. Jefferson. She is an audiologist that practices at Novant Health Pediatric Rehabilitation. As an audiologist, she likes knowing that she can help improve her patient's ability to interact with others. She understands that each patient has an important story and enjoys taking the time to learn about their needs. Dr. Jefferson belongs to the American Speech Language Hearing Association. When not at work, she enjoys learning new languages, spending time with family, attending church functions, reading, and eating a delicious Texas barbecue. We have three other panelists that are very special to us. They are members of the Concord Alumni Chapter. They are Melissa Artis, Monique Sutton, and Latanya Rainey. I'm going to go ahead and pass it over to our medical expert, Dr. Heggs. She's going to discuss how common hearing loss is and the types of hearing loss that we do have.
Great, thank you so much. Good evening, everyone. So happy to be here with you. I appreciate the opportunity. Along with my sort of professional background, I'm a mom of 2 boys. I'm here in Atlanta, Georgia, and great to be among my Divine Nine sisters. I'm a member of Alpha Kappa Alpha Sorority Incorporated. So just glad to have the invitation to talk about this topic. It's so important. We don't talk about enough in our community, and to have 2 Black audiologists among you is really kind of a gem. So I'll just jump right into it. Can everyone see my presentation? Is it visible? So I'll start off by just talking about hearing loss and audiology in general. So a few statistics. Hearing loss is actually the most commonly occurring birth condition in newborns. Anywhere from 1 to 3 out of every 1,000 births, a child is born with some degree or type of hearing loss. So it's more common than Down syndrome or cerebral palsy or any of those conditions we kind of think of that may occur in the newborn perinatal period. But congenital hearing loss is the most commonly occurring. Most babies that are born with hearing loss, anywhere from 50 to 60%, there is a genetic link to that. So there's a family history of hearing loss, but then there's a whole other, 40 to 50% where there isn't. And this may be the first occurrence of hearing loss, in a family that's known. Hearing loss does increase with age, so it is natural for us to start to notice differences or changes in our hearing as we get older. In terms of some of the other prevalence numbers, and I'll walk through each of the statistics here on this screen, anywhere from 1 in 8 individuals in the US who are 12 years of age or older has hearing loss in both ears. And it's actually even more common if there's hearing loss in one ear. So 1 in 7 individuals in the US has hearing loss in at least one ear. And so there are a lot of people that have hearing loss. Most of it is undetected though. It's not something that we typically get screened or tested for as a part of our normal health checkups. It is something that you can request when you go in for your annual evaluations with your healthcare providers. Hearing health is important. It impacts your quality of life. Not being able to hear things appropriately, participate in conversations, limits your access, activity, and participation in just normal activities. And so it's really important to know your hearing status and to have that monitored every year. So the next statistic is about almost 30 million people in the US could benefit from hearing aids. And so I'm sure Dr. Jefferson can attest as well, as we see clients all the time and perform audiological evaluations and do in fact find that an individual has hearing loss. It's really up to the individual about whether or not they want to do something about it. So of these 1 in 7, 1 in 8 individuals who have hearing loss, a lot of it is untreated. A lot of times people do not get the type of intervention, whether that's with a hearing aid or other amplification device or some assistive technology that could really assist them in accessing sound a little bit better relative to their hearing. The average amount of time that people wait before getting some sort of amplification device is 7 years from the time that they find out that they do in fact have a hearing loss. So that's a lot of time lost. There are more and more studies that are coming out now that show a link to cognition, in fact, dementia, and hearing loss, untreated hearing loss. So the longer you go without having some sort of intervention for your hearing loss can in fact impact your memory and your overall cognition. This is a group of women we're talking to, but men are twice as likely as women to have hearing loss between 20 and 69, but that doesn't mean that women don't have hearing loss. Men are just more likely to, and a lot of that is due to noise-induced hearing loss, which I'll talk a little bit more about in just a moment. So I already sort of talked about the number of adults, particularly older adults, older than 70, who could benefit from hearing aids, has ever used them. Sometimes people don't want to use them because of aesthetics or vanity. They don't want to have a hearing aid on because it makes them look older, the stigma around hearing loss, the cost. So there is, a cost related to hearing aids. They average somewhere between $4,000 and $6,000 per hearing aid. So they can be cost prohibitive. A lot of times they're not covered by insurance. And so it is an investment. But if you think about that in terms of an investment of your health and again, your quality of life, then you could sort of see the value in getting some sort of amplification device. Kids, again, do have hearing loss pretty commonly. Sometimes it's due to ear infections and things that are treatable by medicine or some sort of medical intervention. But there is quite a bit of permanent hearing loss that occurs in children as well. So let's just talk quickly about the types of hearing loss. So not all hearing loss is the same. This is a diagram of the ear. So this is what we call our pinna, or commonly referred to as our earlobe. That's our outer ear, then goes into our ear canal, also part of the outer ear, our eardrum that basically vibrates the sound waves from the environment. Then we have our inner ear, which has the 3 smallest bones of the body that conducts the sound to our inner ear. Our inner ear controls 2 things, our auditory system or our hearing, and also our balance system. We don't talk a lot about that at all, but dizziness, being sort of off balance, vertigo, all of that is a majority of that is controlled in our ear as well. So if you're experiencing those types of issues, then you may also want to see an audiologist or an ear physician, an ear, nose, and throat doctor. So when we have problems with our outer ear or middle ear, we call that a conductive hearing loss. And again, a lot of times that is something that is treated. That could be a malformed pinna, that could be impaction of wax in the ear canal, it could be a hole in your eardrum, it could be fluid in the middle ear. So most of those things are treatable and do not cause a permanent hearing loss. Then we get to what we call a sensory neural hearing loss. That is all related to the inner ear, which has lots of little hair cells in there. This actual a part of the anatomy is called the cochlea, looks like a little snail. And when there's damage to the little hair cells in the cochlea, that is permanent damage. We can't get those hair cells back, not yet anyway. There's lots of science that's being conducted to try to regenerate those cells. But right now, once they're gone, once they're damaged, that is permanent loss. And so usually those are the types of hearing losses that don't get better, but can certainly be managed with an amplification device. And then there's the mixed hearing loss, which may be a combination of both. So maybe you have permanent damage and you also have an ear infection because you have sinuses or it's allergy season. And so, of course, that makes things even more complicated. The thing about conductive hearing loss is that it can fluctuate. So some days you can hear a little bit better than others. If you think about if you have small children and they've had tubes placed in their ears, all of this is what we call a conductive hearing loss. And usually once that fluid is gone, once the tube is placed in, then hearing gets better over time. The number one preventable type of hearing loss is noise-induced hearing loss. So no one has to lose their hearing or no one has to have hearing loss related to noise because we can prevent that. You can wear appropriate hearing protection or reduce your exposure to loud noises. I like this diagram because it kind of gives you an idea of how loud things are. We live in a noisy, noisy world. Even your washing machine is like 70 decibels, which is pretty loud. That's like yelling if you think about your voice. Traffic noise inside a car can be as loud as 80 decibels. You know, a lot of times when we're in a car riding on a road trip and then we have the radio on and we try to turn it up louder to cover that road noise. So now we're exposed to even more noise. A leaf blower. So when people are doing yard work, then we're getting into really loud noises that can certainly damage our ears. A sporting event, 100 decibels, concerts, 110. So the main thing here is to protect your ears. If you're around loud noise, put in some earplugs, put on headphones, Same thing if for young children. The biggest thing for kids between 12 and 25 right now are the AirPods. Constantly walking around with mobile listening devices in their ears at pretty loud levels. And so that is causing permanent noise-induced hearing loss. So certainly want to make sure that you're monitoring how loud you listen to your AirPods when you're working out, when you're, just riding your bike, whatever. You want to keep your AirPods at a very reasonable intensity level. Somewhere around less than 50 decibels is what's appropriate. And so what happens is those hair cells inside the cochlea, they get damaged because of the noise, and that is permanent damage. How that relates to communication is we start not to be able to understand things. When there's a sensory neural hearing loss or a permanent hearing loss, we're not able to hear some of the softer sounds of speech, things like the letter S or the letter T or the letter F. So then we are missing parts of the message, which definitely impacts our ability to communicate one-on-one with individuals. There was a statement about some of the things that were recognized in the virtual environment as a result of COVID. And so I always like to promote on virtual meetings the use of captioning so that individuals who may have hearing loss, and we all actually can benefit from this, can see the visual, so they can see the words instead of just always relying upon the auditory. And when you're speaking, if you can, come off camera. In that video in the beginning, that was a great demonstration of how the visual cues of our lips and lip reading is really important for people who have hearing loss. And so being able to show your face so that it's clear, that goes along again with the auditory signal of what's being spoken, really does help individuals with hearing loss. And then I wanted to make sure that we understood that there are degrees of hearing loss. So it's not, you can hear and then you're deaf. So we have normal hearing, which you can pretty much hear really soft things like a bird chirping or the fan blowing. Then as you begin to lose hearing, then you can go to these different categories or degrees of hearing loss. So a slight hearing loss, you still can hear some things like the phone ringing or an alarm clock going off or the blender, but you may not be able to hear the things above that, like a chirping bird or the fan. Then when you get to a moderate hearing loss, you can hear a baby crying, or you may be able to hear, as you're talking one-on-one, but some of these other things, the telephone ringing or the bird chirping is difficult for you. A severe loss, you can hear the dog barking or a motorcycle, but one-on-one conversations are difficult. Profound hearing loss, of what we think of as deafness, those individuals still have some what we call residual hearing, so they may be able to hear or experience vibrations of a airplane engine or a siren or something like that. But any of these things above that, they pretty much are not able to hear. So just wanted to make sure that everybody understands that there is a range of hearing loss. So when we talk about the prevalence in that 1 in 8 individuals have some degree or type of hearing loss in both ears, that means that they could fall anywhere between sort of this slight to profound range, and it could be in one or both ears, or it could be sensory neural or conductive or a mixed hearing loss. So that's where we come in, your hearing healthcare professionals. So what is an audiologist? Hopefully you've heard of us before. Maybe with a quick raise of hands, if you're able to access the reaction buttons on the platform, have you ever heard of an audiologist before? Okay, a few people. Yeah, great, awesome. All right, now another question is if you've ever been to one. Okay. Well, just so that everybody knows what audiologists, who our audiologists are and what we do. So we help to prevent. So we want to make sure that you're born with 2 ears for a reason, that they stay healthy, and we don't want you to get hearing loss if you don't have to, like noise-induced hearing loss. But if you do, then we also diagnose and treat hearing and balance disorders for people of all ages. And we really want to do that because we understand that having good hearing health really leads to better quality of life. So we deal with the evaluation of hearing and balance and tinnitus. That's that ringing in your ears. We certainly can make recommendations and assist people with hearing aids or assistive technology. We do help people. We evaluate and treat dizziness and balance disorders. We're able to provide hearing screenings as well as full diagnostic audiological evaluations. We certainly do work with noise prevention to make sure that if people are in noisy environments, that they have the appropriate protection. And for those who suffer from constant ringing in their ears, you can also be helped by an audiologist to manage that as well. So that is the end of my presentation. I will turn it over to Dr. Jefferson, who'll talk more about sort of what happens when you do go to an audiologist.
Awesome. Thank you so much, Dr. Heggs. While Dr. Jefferson is getting her PowerPoint up there for us, I did see a lot of questions coming in. Thank you for those questions. The doctors will be able to have that chance and go through the chat and see which questions did come through. I did notate some, so if you did miss one, I have it for you and they'll be able to answer you afterwards. We do have a Q&A session right after this. So Dr. Jefferson, let me know when you're ready.
Hang on, as you can see by the fact that I don't have a cool background, I am not good with computers. So give me a second here. All right, can everybody see and hear?
Yes, you're all good.
Okay, so I appreciate the invitation to speak to you all tonight. It's an honor. And Dr. Heggs, you did an excellent job. Hopefully I can follow up here. All right, so I am going to talk about what happens when you actually show up to see the audiologist. So we are going to go here. All right, so when you are coming to see the audiologist, the first thing typically that will happen is a case history will be taken. So for me personally, I want to make the patient feel comfortable. I want to build a rapport. I want to understand their reasons for coming to the appointment. As Dr. Heggs was mentioning, it takes people a long time before they come to the place where they are ready to do something about hearing. So I want to kind of see where people are in that journey when they arrive. So we'll take a medical history. Is there a family history of hearing loss? Have you had any surgeries? What kind of medications that you take? There are some medications that can affect hearing. Those kinds of things are helpful to know. And if there are hearing concerns, I want to know how those impact daily life, because that's going to help me to know how to proceed with test protocols. So one of the first things that we're going to do before we go into the sound booth is an otoscopic examination. So I'm going to look into the ears with my light. I'm going to check the outer ear to make sure there are no kind of growths or pits or tags, any extra skin, because that can be indicative of an issue with hearing. I'm going to check to make sure that there are no, there's no wax in the ear that's blocking the canal. There are no foreign objects. That does happen. I've seen some interesting things in some ear canals before. And I'm just going to take a look and just make sure that the ear canal skin is healthy and take a peek at the eardrum to see if there might be some fluid or anything else that's telling there. All right, so we have a couple of subjective, actually objective tests that we would do outside of the booth that give us information. You as a patient would be required to do nothing. The audiologist would simply place a tip in your ear. One of those tests is called tympanometry. And once we place that tip in the ear, you'll feel a little bit of pressure change, and that's going to actually help us to determine the status of your eardrum and your middle ear system. So if you have a hole in your eardrum, this test is sensitive to that. If you have fluid behind your eardrum, this test is also sensitive to that. Dr. Heggs was mentioning the 3 smallest bones in the body. that are in the middle ear space, those bones are connected to muscles. And those muscles contract when a loud sound is entered into the ear. So that we can actually do a test that's called an acoustic reflex test. So people whose muscles do not contract to a loud sound, that can indicate that they have hearing loss. So these tests tell me a lot of things even before we go into the sound booth. So there's one other test that we typically will do that's helpful. It's called a distortion product otoacoustic emission, so DPOAEs. So what this test does, we put another tip into the ear. This is helpful for children or for other difficult to test patients because what it will do, it will send a sound into the ear. And the cochlea that Dr. Higgs was talking about, those hair cells in particular, there are outer hair cells. And what they do is when a sound goes into the ear, they actually produce a sound of their own, an echo. That this machine can measure. And typically, if we get those echoes back, hearing tends to be pretty normal. If we do not have those echoes, then that can show that there is likely hearing loss. So that test is very helpful to establish what may happen once we do a hearing test. So when we go in the sound booth, which is what everybody typically thinks of when they think of an audiologist, you'll have headphones placed over or in your ears, and sometimes even behind the ears. There is a headphone called a bone conductor that we can actually place behind your ear here that will directly stimulate the cochlea. So we typically will use that if we're trying to determine the source of a hearing loss. Is it mixed, is it conductive, or is it sensory neural, as Dr. Higgs was speaking on earlier. We're going to ask the patient to respond to the softest tonal stimuli that they can hear for different frequencies. So typically you would raise your hand, hit a button, or say yes when you hear the beep. And then we also will ask patients to repeat words. One set of words is used to verify that the patient is not faking. We do tend to have people who will come in and actually try to fake a hearing loss. So don't do that. We actually have tricks that we can actually catch you, so be careful. And then another test, you repeat words at a loud level to determine your prognosis with hearing aids. If I say words to you at a loud level and you get most of them right, then that tells me you'll do well with a hearing aid. If you don't say as many words back correctly, then a hearing aid may not be the best option for you. You may want to have another type of hearing aid, maybe a cochlear implant may be best for you. All right, people often ask, how do you evaluate children? And as mentioned previously, I'm a pediatric audiologist. I have tested adults in the past, but this is my bread and butter. There is a gold standard test. It is called auditory brainstem response. And so the little guy here in the car seat has electrodes on his head and earphones in his ears. We can actually monitor how the brain responds to sound. So the baby has to be asleep. We play sounds into the earphones and we see waves on our equipment to indicate when there is a response. And so that's an easy way for us to test. In the sound booth, we can also test children. What we would typically do for infants or young toddlers, we can watch their behavioral responses. So if I present a sound and a baby stops sucking a bottle, I could say, oh, the baby heard that. Or if their eyebrows raise consistently when I present a sound, that's the way that we can test. We can also train a child to turn their head when they hear sounds. In our sound booths, we have videos set up in the corners. So I train a child whenever I present a sound, I turn on a video that has something that kids enjoy. And so when I play that sound, they learn, oh, that sound is on, let me turn my head. So that's a way that we can determine how a child is hearing. And then also we can get a child to play a game. So when you hear the beat, instead of raising your hand, you can throw a toy in the bucket. You can build a tower with Legos, things like that allow us to test children. So what if after you've seen the audiologist, there is a hearing loss that's diagnosed? What happens now? So if there is something that needs to be treated medically, we would send you to the ear, nose, and throat doctor. So if you've got fluid, if you've got a hole in your eardrum, anything like that, we would send you to an ear, nose, and throat for them to take over. So segueing into that, what's the difference between an ear, nose, and throat physician and an audiologist? So An audiologist is a healthcare professional, and we have either a doctorate degree or a master's degree. And the ENT actually has a medical doctorate. So as an audiologist, I don't prescribe medications or anything like that. That would be the ENT's wheelhouse. They would be the ones who would perform surgeries, medically manage the hearing loss. As the audiologist, I would simply diagnose, and then, like I said, if there's anything medical that needs to be done, that would be the ear, nose, and throat's jurisdiction. All right, so when you have hearing loss, how does that affect you? Patients that typically can receive benefit from hearing aids, they hear, but they're just not able to understand, just like Dr. Heggs was saying. So, there are certain parts of speech that become more difficult to hear as we age. We typically tend to lose our high frequencies where, just like she was saying, the S sounds, Fs, THs. So people hear, but the clarity is just not there. They may easily misunderstand what's being said, especially when there are multiple speakers and there is background noise present. And patients with hearing loss tend to become frustrated because they're not able to communicate well with others. They become discouraged and they'll withdraw from social interactions. And just like Dr. Heggs was saying, untreated hearing loss, it's been linked to cognitive decline. So if we can treat with hearing aids, we definitely want to. And then if you are in the market for hearing aids, most people tend to not know exactly where to begin. Going to the audiologist is the best place to go to start. And then if you're diagnosed with a hearing loss, they can take it from there, like I said, unless there's a medical necessity to go to the ear, nose, and throat doctor. If you are in the market for hearing aids, people often hear the story of somebody who has hearing aids. I paid thousands of dollars for these things. They didn't work for me. I didn't wear them. What people have to understand is we have to have realistic expectations with hearing aids. It's not like glasses. I put my glasses on, I see. When you wear hearing aids, your brain, it takes a little bit of time for it to acclimate to listening and hearing with those hearing aids. And so consistent use at the outset is very important to allow your brain to acclimate and then normalize how you're hearing with the hearing aids. So definitely, if you are in the market for hearing aids or a loved one, let them know. We have to have realistic expectations. There's some work that has to be done that takes a little bit of time to get used to them. And then if you're in the market, be sure wherever you end up going, there are a lot of different places, Beltone, you got Costco's, you got medical model like Novant with us. Be sure that you're comfortable with your audiologist and that you are definitely confident that they are able to properly program your hearing aids. I often tell my patients, we're going to be in a relationship. So, I mean, if I need you to be able to trust me, you got to be able to be comfortable talking to me and telling me what you need, because if you don't feel that way, then I can't help you to the utmost ability. So definitely make sure that you have a good rapport and a good relationship with whoever would be fitting your hearing aids. And then once you are fit with the hearing aids, get ready, because the world is loud. Get ready for all the sounds that you'll be able to hear. And then just finally, I want to kind of just touch on briefly some communication strategies. I think this is awesome that we're talking about how to engage with people with hearing loss. So some of the things that you should be aware of, if someone has hearing loss and you know about that, if you gain their attention before you start speaking, that goes a long way. You can't talk to them from down the hall. You definitely want to make sure that they know that you're saying something so that they can attend to that. And then you definitely want to watch how fast you're speaking. Now, you don't want to slow it down tremendously, but you also don't want to talk fast to give that person the chance to be able to pick up on your facial cues and to be able to pick up what you're saying. And like Dr. Heggs was saying, you want to just have a clear view of the face. We pick up a lot more facial cues than we realize. And I think that became apparent when we were wearing masks. Even people with normal hearing, we are watching faces. We are looking to see how people are reacting, and being able to see is helpful in that. Like I was saying before, background noise is the enemy of people with hearing loss. So make sure that you try to limit that as much as you can. And if possible, say what you're talking about. Hey, let's talk about what we had for dinner last night. You kind of give a context that allows people to be able to kind of have idea of what is being said so that they can follow better. And then whenever you know that there is a communication breakdown, you want to not necessarily repeat what you said. You can always rephrase what you said, because somebody might be able to catch on better if you say different words. And then as always, we want you to be patient. I know it can be frustrating sometimes, but being patient goes a long way for those who have hearing loss. And that's it for me.
Awesome. Thank you so much, Dr. Jefferson. And again, we did see some of those questions coming in. They will be addressed in the chat or in our Q&A session right after this. Right now, we're going to go ahead and pass it off to our members that are in the Concord Alumni Chapter. We're going to start with Sora Melissa Artist. She's going to tell her journey with this hearing impairment.
All right, good evening, everyone. Thank you for coming out. I'm gonna be short. I was first started experiencing it, I think, well, noticed it or admitted, I should say, that I had some hearing loss probably around 2008. And my primary care physician referred me to an ENT, and I went to see an audiologist. And the experience was absolutely horrible. I left there feeling like I was stupid or something because the audiologist ran in the booth during the middle of the test, was like, I know you hear something. And I'm like, ma'am, I do not hear what you're saying. And so that just shook me. I was done. I didn't go back. And it got progressively worse. And I remember the day I was at work, someone was talking to me. They were standing not even 10 feet away from me. My back was to them and they were calling my name and I didn't hear them. And I said, you know what? Enough is enough. I need to go back. So I did. And the new audiologist, she apologized for what happened because I went back to the same office and she looked at me and she did my test and my hearing had actually gotten worse. And she said, you know, Melissa, it doesn't get better. It's going to get worse. So I had to come to terms with that. And as they spoke of, the cost was just astronomically high. I was like, what? And my insurance did not pay for it. I was like, I'm a teacher. You pay for me to get classes, but you don't pay for me to hear, you know, and I need to hear my students and my families. So that was that. So it was around 2011. And so at the time I was 37 and they told me I had hearing of like an 80-year-old. And I was like, what? So, you know, needless to say, that was a shock. And my family and friends, you know, they supported me this whole time. They slowed down. And initially, remember the first year I went to homecoming after getting my hearing aids, I actually called people and told them, hey, I may have hearing aids because I was slightly embarrassed. But over the years, I'm okay if I don't understand what people say. I ask them to repeat themselves. I definitely say, can you slow down? Can you repeat that? Or can you look at me when you're talking to me? And why are you talking to me all the way over there? So I've learned to advocate for myself in situations that I normally in the past would not. And so I would just say, like I said, in the last couple of years, I've become more comfortable with speaking out and letting people know that I do have a hearing impairment. It's not getting any better. I have sensory neural loss. I have the tendinitis, so I had a constant ringing in my ears. And I tell people the hearing aids don't make my hearing better. It just makes it better. So I just need them to work with me. And as Dr. Jefferson said, all those tips actually help people like myself who are struggling. So that's my story. And I'm a proud person with hearing loss and I'm an advocate. I tell my families at school when our scholars are having issues with hearing to definitely go get that checked out, because with me, I may catch the beginning and the end of the words and sometimes the middle is all mixed up with math. That was horrible, and accents. Oh my goodness. So that's that. Thank you.
Thank you. Next we have Sora Latanya Ramos. I'm sorry. Raimi. Yeah.
Hello, everyone. I'll try my best to condense my story as well. That's going to be difficult because I have been dealing with a hearing impairment for over 40 years. So for my story, I was not born deaf. However, at the age of 5, when I was in preschool, that's when my hearing impairment was starting to be noticed. My preschool teacher talked to my mother and was like, well, she's not hearing everything in class. So that's when my mother initiated to start to get me testing, and they realized that I was beginning to lose my hearing. So I had been wearing hearing aids since the age of 5. So I been through the behind the ear, the in the ear, the different, styles have changed. Growing up, going through school was difficult because, again, we're talking back in the 80s. I feel like technology has so far advanced and people did not know how I would have made it in the normal hearing world, so to speak. So it was challenging, with kids growing up, getting used to it, difficult with conversation, even teachers in the school. How do you deal with a deaf child in a classroom? Going through that, the different technologies. I've been through the teacher wearing a microphone and having that sound go directly to my ears and things of that nature. So it was a journey, but it made it through school, and then going through college was another challenge, I should say. And then for me, it was interesting because when I went to college, I was more worried about how am I going to wake up in the morning to go to class. So for 7, I can't hear an alarm clock. So I've always had my mother there up to the age of 17. Now I'm leaving home. What do I do now? But by the grace of God, somehow He sent that sunlight through my window in the morning. I was on time for those 8 o'clock classes in the morning. So, but made it through there, and it was quite a journey and a challenge. Even going through college, and those of you may know, you're in those big auditorium settings, teachers writing with their backs to the board, having to talk to them after class. I need you to turn around and face me, having to read the book, and like you said, putting the pieces of the puzzle together because I was missing some things here and there. And then transition through the working world, if we should say, getting, even that was a challenge because even I think employers, you're not supposed to discriminate, but I think there was also a safety factor, if you will, depending upon the industry that you're in. I'm an engineer, so I was working in the production environment, and that's like, plants and things that can be real prone to safety. So I can understand that aspect. But nevertheless, getting into more interactions with people in the working world. And then at the time, I was actually living in Oklahoma, and I needed some new hearing aids. So I went to an audiologist in that state to get my annual checkup. I need new hearing aids. Well, this person kind of looked at me and says, have you ever thought of a cochlear implant? And of course, I'm not here for hearing aids. I'm not here for no implant. I've heard about it, but I didn't know a lot. Long story short, it took me about a year to make a decision, and I made the decision to have the cochlear implant surgery. I only did it on one ear, on my right ear. I was bilateral, sensorineural hearing loss, wore 2 hearing aids. I got the cochlear implant surgery on my right side. Best decision I ever made. And again, as Dr. Hezin Jefferson was explaining earlier, is those hair cells. So the hearing aids help amplify the sound. The cochlear implant helped me to understand better what the people were saying. Now, I still have my challenges. I still depend heavily on lip reading and things of that nature. I can totally relate to all the tips and the information that was shared previously in the conversation. One thing I will say that I would want to leave you with, since I've been through this journey from a child to an adult, it doesn't have to stop you in doing things in your life. If you have young children or young kids, there's so much advanced technology out there and so much help and assistance. Don't be afraid to seek that help and that assistance, and also let that child or that person know that hearing loss does not stop them from achieving their dreams and goals that they need to. So I will wrap up my story at that point. Thank you.
Thank you, Sora Rainey. Lastly, we have Sora Monique Sutton.
Good evening, SOARs and guests. I'm glad you all took the time to come to this. Oh my goodness, I just lost the word. My story, it's not really long. I come from a family where the majority of my family members on my paternal side have some type of hearing loss. So around 8 years ago, my husband requested that I go get my hearing checked. And at that time, they had said, my audiologist had said that I needed a hearing aid. But like both doctors presented, I just wasn't ready to do that. I think it was vanity. And some of it was I was concerned about how was I going to use my stethoscope? I work in healthcare. How's that going to work? I can't take them out. And then I just didn't want to spend that much money on hearing. And I thought that I was doing pretty good for the most part. It didn't seem like I didn't hear what was going on, but if you don't hear, then you don't know you're missing it sometimes. And so fast forward, COVID happened and everyone started wearing a mask. And that was awful for me. I couldn't hear my patients, and I didn't realize how much I rely on facial expressions to know what someone's saying to me. So with just their eyes, I couldn't tell, is this a sad story? Is this a happy story? Or it just threw me off. So I had all the toys in my exam rooms removed because background noise I couldn't take. I even changed the positioning of the chair so that people couldn't sit on this side. They had to sit directly in front of me. But even doing all that, I just continued to struggle. So then finally I decided I got to do something about this, and not to mention the isolation, because I started not going to events where they take place in a restaurant or they take place where there's going to be a whole bunch of noise, because it's hearing fatigue. I felt like I'm working so hard to hear what's going on that I'm not even having fun. I would rather just stay at home. So fast forward, I decided this is it. I need to do this. And my audiologist found me hearing aids that I love my hearing aids. I'm not tech savvy, but they're Bluetooth. So they announce who's calling me. Oh my gosh. So all the times I didn't answer the phone, my husband's like, oh my gosh, he put it on vibrate. He put it on everything. I just, for whatever reason, couldn't return a text. This announces everything. People at the store are always confused because I'll just start talking and you can't even really see them. So that vanity portion is gone. And Atrium is where I work. They bought me a special stethoscope. So I don't actually have to put it in my ear canal. I can just kind of put it around my earlobe, and it magnifies sound by like 40. It's like so loud. So it didn't interfere with my job. So getting my hearing aids, best thing I have ever done. And I'm not quite sure why I waited that long. And on top of that, my company actually paid for all but $1,000. So where I thought it was going to be several thousand, they were, but my company actually will invest in you being able to hear. Not a lot of things, but hearing is important to them. So I definitely advocate for people who are reluctant to look at hearing aids now. They are remarkable, absolutely remarkable. And like I said, I don't know why I waited so long. And that's the end of my story.
Wow, thank you so much for sharing. We did want to give a chance for those that are here to ask a few questions. If you did have a question that you weren't able to put in the chat, you can go ahead and come off mute and ask your question to either the doctors or the panelists.
Hi, this is Dana Driver. How are you?
Good, how are you?
Doing good. And I'm sorry if I missed this, but is hearing loss hereditary?
I'm happy to answer that. Thank you for your question. So about 50% of hearing loss is related to genetics. Yes. And so there's actually been quite a bit of research that has linked to specific genes. And when babies are born with hearing loss and it's identified very early, part of the medical workup that's recommended is that genetic testing occurs as well, just so that the family may have some indication of the cause of the hearing loss if there is one, and that helps with family planning if people want to consider that as they have additional children. But yes, about 50% of hearing loss is genetic.
Thank you.
Awesome. I see another question. Does being born deaf always result in being mute?
Not at all. So again, there's degrees of hearing loss. If a child is born with profound sensory neural hearing loss, getting now a cochlear implant in one or both ears is a really great way to assist a child getting access to the auditory signal, where they're able to then get pretty intensive speech and language therapy or rehabilitation, where they learn to listen through the cochlear implant and become use speech if it's possible. That's not necessarily the outcome for everyone, but it does certainly increase the ability for kids to have access to sound in a different way with the use of cochlear implants, in addition to the therapy that goes along with it. So just putting on a cochlear implant is not going to be sort of like putting on a pair of glasses and you can hear everything all of a sudden. There's a lot of intensive, therapy that goes along with it to allow children to become listeners and speakers.
I will piggyback off of that real quick and just say, as a young child, I did have speech therapy in school, so that really helped, as well as being deaf and having the speech therapy.
Awesome. I do have to ask, if you are going to ask a question verbally, please turn on your cameras, or you can place the question in the chat and I will read it off for you. So I'm going to call on James Jefferson.
My cousin.
Right, I would say that's your cousin.
I do apologize. Can you ladies hear me?
Yes, sir.
Yes, absolutely. So James Jefferson here, member of Phi Beta Sigma Fraternity Incorporated. And so just as a clinician, I was wondering, has there ever been any type of research you guys have come across, or is there any correlation between maybe hearing loss within teens or young adults that maybe correlates to anxiety or depression or any other type of mental health diagnosis that we may know of?
Dr. I'm not aware of anything, or are you necessarily?
I think generally individuals who have hearing loss do suffer from anxiety a little bit more than those who do not. And some of that just has to do with, again, missing out on things. It's stressful to try to hear and listen in different environments. But I don't know if it's specifically related to sort of that age group or that population.
Yeah.
Awesome. I did get one in the chat. I'm going to go to that one first. They said, hi, is there a relation of hearing loss and autism with their son being nonverbal?
So anytime there is a diagnosis of autism, I definitely want to rule out hearing loss. I have several patients on my caseload who are autistic and do have hearing loss, but the vast majority of kids who are autistic typically have normal hearing, but it does happen where a hearing loss is present. So you definitely want to get tested anytime a child has a diagnosis of autism. A test is warranted, hearing test.
Can I say something? I actually work with children, developmental and behavioral pediatrics. Before we actually make the diagnosis in our office here, before we make that diagnosis, we always have their hearing and vision tested, because it's a diagnosis that we say we won't use that diagnosis unless we exclude another reason for the behavior or the developmental delay.
Okay. So I'm not sure who raised their hand first. I'm sorry. So I'm gonna go with Crystal Blair first.
Hi, can you see? Oh, honey, I look terrible tonight. Sorry. No, I do have a question. So I have a son, he's 12, and he had chronic ear infections. And so we've had to have probably 4 different surgeries when he was very small for ear tubes. So I'm just wondering, is there any kind of correlation with him, well, with hearing loss and, you know, having to go through all of those surgeries, you know, with him hearing, you know, hearing in the future? He hears pretty well, and he's had a test recently and it's been fine. I'm just wondering, you know, if any correlation between those two.
Yeah, so there can be some correlation sometimes. If there have been multiple sets of tubes that can sometimes leave scarring on the eardrum, which can lead to hearing loss of some degree. If he's recently been tested and all seems well, you could just continue to monitor that. During well-checked visits at the pediatrician's office, he can get screened. And if you want to up the ante, he can always go to an audiologist's office at least once a year to get checked, just to stay on top of that.
Thank you.
Thank you. So next we have LaShawn Kelly.
Hey, good evening. Thank you very much for your expertise this evening, and thank you to the additional panelists for sharing your stories with us. I placed my question in the chat very early on when Dr. Heggs was speaking. It was in relation to audiology screenings. Are those screenings covered by insurance similar to our wellness exams that we go to annually and are covered? And then my second question is, I have an 11-year-old daughter who has, like the previous member, I forgot her name, who's had ear infections, tube placements, and who will tell me if my music is loud or if the television is loud, that it's too loud, Mom, could you turn it down? Is that something that I should get checked out for her, just to ensure that she doesn't have some sensitivity going on there? What would be your recommendation?
So the answer to the first part of your question is yes. Most insurances do cover annual audiological evaluations, especially with a physician referral, even Medicare. So you should be able to get a hearing test if you want one and you have insurance. And then in terms of the auditory sensitivity that your daughter is experiencing, yeah, it's really important to get that tested. Sometimes that can be related to, we didn't talk about this, but we actually hear with our brains. And so we didn't want to, you know, we could have spent like many hours talking to you all about this, but a lot of times we just think about the peripheral side of our hearing, but the sound waves go up to our brain, they're processed by our brain, and sometimes that's where the breakdown is. Actually, it has nothing to do with that outer, middle, or inner ear, but it's about what happens to the signal once it gets to the brain. Sometimes, you know, there are breakdowns with that causes auditory processing deficits. And so sometimes when there is that oversensitivity, that might be related to some of that going on. But there are additional types of tests that can be done that aren't anything about what we talked about here tonight, but there are additional testing and evaluations for sort of auditory processing related concerns that, you know, might be appropriate for your daughter if she's experiencing those types of sensitivity to different sounds.
Thank you. I greatly appreciate that. I will connect with the pediatrician. Thank you.
Awesome. Thank you for your question. And we have Jewel Mack.
Hello. So one thing I noticed within the last couple of months with me is either I have diminished hearing in my left ear or it's really magnified in my right ear. So I have an ENT appointment in the next couple of weeks, actually. For the acoustic testing, are those tests typically uncomfortable or painful? And how long does testing typically take?
So when you come to see the audiologist, nothing should be painful. We just place the tips in the ears or the headphones over the ears. So those things should be okay as far as no pain. So the first half of the testing that I was talking about, tympanometry and the otoacoustic emissions test, those take maybe 30 seconds, if that, for each ear. You just have to have a willing participant who sits still and is quiet. You can get those pretty quickly.
Thank you.
Good luck with your ENT journey. I hope everything works out for you.
I hope so too. Yeah, I just happened to notice it when I was talking on the phone, because I usually talk on my left ear. So then when I switched it to my right ear, I was like, wait, that sounds different.
Yeah.
And so it's really magnified on my right ear and really diminished on my left. So I don't know which one is actually the problem.
Yeah. Yeah, definitely ENT for sure. You're doing the right thing.
Thank you.
Awesome. Thank you for those questions. Does anybody else have any more questions before we go ahead and close? All right, so I want to thank everyone here and the panelists for coming out today and enjoying our panel discussion about hearing impairments. If there are further questions, you can always reach out to the chapter's email and we can direct you to the proper channels to get those questions answered. Other than that, on behalf of the Concord Alumni Chapter of Delta Sigma Theta Sorority Incorporated, we thank you so much for coming and we will see you at our next event.